Hi, good morning. So over Shabbos, I was talking to some friends of mine who also work full-time. One is a lawyer, another one is an accountant. And we were talking about how often we get the question of, wow, how do you do it? How do you work full-time? How do you have a career? And the answer that I love most, which so many friends of mine say, who work full-time, is when someone asks them that, they say, we just do it. Anyone can do it. You can do it too. And the fact is that many people, many frum women, work full-time. And how do we do it? We just do. Everybody has their own way of making sure that everything gets done. And we do it. And anyone can do it. We're not special. We're not unique. We just made a decision and we're doing it. I have many friends who are full-time physicians. I have friends who work full-time in businesses, who are accountants, who are professionals. There's so many different types of jobs that frum women can do working full-time. I also have a lot of friends who don't work outside the home at all. They have decided to be full-time stay-at-home mothers, and I think that's wonderful. I also have friends who have decided to work part-time, and they make it work. Whatever it is that you've decided to do with your life, you make it work, you make it happen. And today I change in my profile the link, and the link is to an article that I wrote a little while ago called Stop Being Surprised That I'm a Physician and a Mother. Because it's so interesting. Out there in the real world, at home, people want to know, how is it possible that I'm a doctor and I work full-time? Because I'm a mother, I have 4 kids. But in the hospital and out there in that real world, people want to know the opposite. How is it possible that I'm a doctor, but I also have a family? So it's like we need to tell different parts of our story to different people, because each realm has its own questions about the opposite realm. And the truth is, for people who ask me questions about how is it that I'm a doctor, I have a whole story that I tell them. Well, I have full-time help. I don't do my own laundry. This is how I set up my cooking. This is how I set up my cleaning. This is how I set up my kids. This is how I set up my carpool. I have all kinds of questions and answers. And then on the other side, when I'm at work, it's a whole other sort of questions. Well, we know you're a doctor. You're here. How is it that you have a whole entire family? And I remember, especially as a resident, I was among a group of doctors in training, and very few of them had families. None of the other women had kids. There was, I remember one co-resident of mine had a daughter, and every time his daughter was sick and he had to take off from work to go pick her up early from daycare, he was considered an absolute hero. Wow, he's such a good father. He's taking turns with his wife. His wife also works, so when his daughter is sick, he also goes to pick her up. And on the other hand, I would never have even imagined leaving work early to pick a kid up, because there's such a stigma against female residents and female doctors being, quote, distracted by their family. So there's a whole other world out there where people have the opposite question, not how is it possible that you're working while you have a family, but how is it possible that you have a family while working? So there's a lot of different aspects of your life that people in different scenarios, different situations can understand, and it's really fascinating what their perspective is when you're in each one. Have a wonderful day.